My name is Dr. Orlando Cerise, and I am the founder and owner and medical director of New Wellness in San Antonio, Texas. New Wellness was started simply because of a huge need in medicine in the United States. Approximately about 5 years ago, I attended a conference in Boston, Massachusetts that was kind of an epiphany. It basically was an eye-opener. I realized that for the last 25 years of my life, I had been spending my entire career treating diseases, but I hadn't done one single iota to prevent disease. And this is an unsustainable approach. We cannot continue practicing medicine in the United States like that. One of the purposes of New Wellness is weight loss. And we have a program that has been exceedingly successful in the management of weight loss in many, many patients. We also do hormone replacement therapy, and not all hormones are created equal. We have a tailored approach to the individual needs of the patient, and we can also look at nutrition both from a macro and micro evaluation and the nutrition analysis of patients' health. If we wait until we treat the disease, we're already too late. We're just ameliorating the symptoms at the end, but we're not touching disease. And this conference essentially opened my eyes about what else can we do. And in my personal practice, I found that that's exactly what I was doing. I had become very, very good over the last 25 years treating problems, because that's all I did. I treated problems, but I wasn't preventing problems. And in the process of waking up and evaluating this, we created New Wellness to afford patients a different format, a different avenue of seeking better health and achieving better results in healthcare. At the beginning, it was difficult because of many patients did not know what we were doing. So educating the patient's acceptance. Many other referring physicians, did not know what we were doing. So it was difficult in that sense. Insurances, are still a problem, and we don't deal with insurances because they simply don't cover what we're doing. But once patients started to accept and understand what we were doing and they were seeing their results, they started accepting it. At the beginning, it was funny because many patients, not patients itself, but many other physicians and other doctors referred as a bad medicine, or alternative medicine. And my approach, my philosophy was maybe perhaps this is an alternative to bad medicine. I had not always been interested in functional medicine. This is something that I became aware about 5 years ago, and I am absolutely pursuing a fellowship and a board certification in functional medicine because of the power and the impact that it has on healthcare. For the majority of my career, I practiced traditional medicine, okay? And I think that nowadays there's a difference in how I can practice. I believe it's a better approach. Wholeheartedly, I believe it's a better approach. And I think it is absolutely a better quality of medical care. We have seen patients that have struggled with weight most of their lives, including myself. I have done every diet imaginable that until I did our program, and I found that after 6 weeks I had lost 36 pounds in a 42-day period, that I became a believer in what we're doing. Same applies to many patients that really approach this with a whole heart. You can't do programs like this half-heartedly because they do not work. But the struggles that patients have received, the struggles having patients get off medications, diabetic medications, for instance, or hypertensive medications, when they do a weight loss program and they find out they don't need to be on it or decrease the dose and be able to get off cholesterol medications now because they have a healthier weight and they learn how to eat healthier. We're able to evaluate many things that rather than just because your cholesterol is elevated, many doctors write a prescription for cholesterol medicine. We find out, why is your cholesterol elevated? For instance, are you over-absorbing cholesterol or are you overproducing cholesterol? And I think that gets to the root of treating the problem and the disease better than rather than here, take a medication because your cholesterol is elevated. So the success that we have seen and the gratification and the Happiness in some of these patients has been worthwhile the journey and every struggle we've encountered. Besides the major health issues that we've seen and improve, one of the most impressive endeavors that we have encountered at New Wellness is transformation in hormone replacement therapy. Many of these women are significantly incapacitated by the change of life, menopause, and some of these women really are, having a struggle with their own daily lives. And as I see many of these patients, some of these patients still have what I hope is the other half of life to live. Some of these patients are going through menopause at much earlier ages, in the 40s, and I fully expect them to live past, into their 80s. And I tell all these patients, this is half time. You got to live the other half, and it's what I'm worried about is that. And the satisfaction and the life-changing experiences that putting the right patient on the right hormone replacement therapy have been so rewarding. I mean, we have now a tremendous amount of patients that have changed their lives completely. Their life-changing experiences in the way that they feel. Some of these patients also, the nutraceutical evaluation, correcting nutritional deficiencies, where all of a sudden they start, we start treating some of the symptoms, like for instance depression, with the right nutraceuticals and the right probiotics, and all of a sudden they're not able to be on medications anymore for depression. That has been so rewarding. So it's approaching health and approaching medicine from the root level, from the what really caused the problems. We're going back to medical school. Not that I remember a whole lot that I learned in medical school because that was years ago, but we're studying and the disease processes and approaching this from a biochemical and a physiological approach that is rewarding. These results have been equally worthwhile and been equally rewarding in both men and women. We treat both of them. Because my specialty is in obstetrics and gynecology, the bulk of my practice is women, but we're starting to see their husbands, and we're starting to see friends they recommend, and it's been rewarding on both sexes. My name is Dr. Orlando Cerise, and we invite you to come check out New Wellness. We're here to help you. Our motto is You Simply Better, and we really mean it. Y hablamos español.